Hey, we have in the news this week, the CEO of Johnson & Johnson says we'll likely need an annual booster shot. Is he just selling vaccines, or you think that's likely?
I mean, I think all this talk about the variants recently does say that the virus has the ability to change. I don't know if it's going to be annual every year for every year that we live. It might be annual for the next few years to kind of catch up with what's going on. Hopefully, as more of the world gets vaccinated, though, transmission starts slowing down, the rate of these variants showing up starts going down with it. So, there's definitely a need for updated vaccines now. There's actually a lot of look at a vaccine towards, all coronaviruses. So we use this as a way to get rid of the common cold as well. So, yeah, there's going to be a need for more, but it's going to be interesting stuff coming out of the future in terms of what that means.
Yeah, okay. Back up. You mean this pandemic could finally the cure for the common cold?
Yeah, exactly. So there's lots of looks now. Coronaviruses, there are 4 coronaviruses in the context of our common cold. Knowing that we're going to have other coronaviruses in the future that may cause pandemics, we've already had 2. There's 3, actually. There's a lot of look in saying, hey, can you make a universal coronavirus vaccine and put that into humanity? The benefits are less people are going to get colds on top of being protected against COVID-19. So really interesting work, really preliminary, but that might be the future of all of this, is we get rid of another disease while we're getting rid of this one.
Yeah, very interesting. Let's talk about origins. The WHO just came out of their team in Wuhan came out with their preliminary report. They're saying it wasn't that lab, but they are looking at another species jump, likely bats. And they're also looking at frozen food. What are you hearing within your community on the origins?
Yeah. I mean, the frozen food thing is interesting. I think many countries that have had low rates of transmission, we talked about, New Zealand, where they had blamed an outbreak on frozen food. We know things don't transmit very well on surfaces. They may, in the context of something being imported or exported, it might be a possibility. It's really, really unclear. The more likely example is, again, a species jump, which has been the way that other coronaviruses have swapped, other viruses have swapped to humanity. But obviously a lot of work that needs to be done, and the answer may not be completely found out during this trip.
Yeah. Hey, when you're out and about, are you always looking at masks, and is it driving you crazy? Like, no, don't be wearing that. Like.
Yeah, I mean, there's a few mask things that are starting to pop up. I mean, I think people are still wearing the thing with the valve on it, and please don't wear that. It's as useless as wearing nothing at all. And then the mask that's down, right? Like, as much as I think the masks work, it works when it's on your face, right? It slips down your nose. You don't realize you're doing a task, and it's already down, right? And so, most people are hearing well, but there are the occasional folks that are slipping up, and so be it. Just be cognizant of it.
Yeah. How are you feeling about the numbers right now, where we're at? And of course, we have things like, schools reopening, and the economy will be shortly, loosening up or opening back up.
Yeah, I mean, I think we're going in the right direction. I mean, the Hamilton region has been doing exceptionally well considering where we came from. Hospital capacities are getting better in our region too. There's still some pressure, but it's not as bad as it was 2 months ago. We're heading in the right direction. Hopefully schools can be open safely, and the rest of society is going to be a bit trickier. Still the same adherent rules come through. If you stay in your household as much as possible, make as minimal trips as possible, try to keep your kids in school as much as possible. Hopefully people do adhere, get tested, and things work out, but it's going to be a couple of months of probably up and down before we get through this and vaccinations start hitting population large scale.
Right, and the rollout and the delivery starts smoothing out. All right, well, we've run out of time, but we appreciate the weekly check-ins with infectious disease specialist Dr. Zain Chagla. Thanks so much, Zain.
No problem. Take care.